Hello. Welcome to Essentials of Pathophysiology. My name is Dr. Jennifer Anthony, and I am the National Student Support Specialist here at Rasmussen University. My goal is to promote student success, which starts with supporting you, the faculty. This course is the cornerstone to all future nursing courses. I personally look at physical assessment and essentials of pathophysiology as the concrete blocks that all future building of knowledge is built upon. It is the key that students must embrace this course and the challenges that come with it. However, for those of you who are seasoned to this course, we all know that many students struggle. Thus, I have created a few documents to help you as faculty guide the students. However, the majority of this initiative is based on student-driven support. Each week, I will be sending you as faculty an announcement with a minor, small video to post in your announcements. This short video will be how to prepare and study for the course modular objectives, how to take notes, and how to begin thinking like a nurse using clinical reasoning and documents using the clinical reasoning process as the foundation for all their knowledge acquisition. This short video that I am doing now for you gives you, the faculty, an understanding of what those little bursts of cheerleading and guidance towards students will involve. I look forward to your comments and your ideas about how to improve the process, initiate or engage students in helping themselves be the best student nurse and future licensed nurse they can be. This initiative will begin in week 2, as week 1 content is very much cellular in nature and hopefully would be a great amount of review. However, we all know students need more than that review. But again, it is their responsibility to learn how to determine their needs, ask for help along the way, and reiterate that all of these little mini sessions will help guide the students in helping themselves with their own specific needs to be successful in this quarter. So let's begin. First and foremost, I'm going to share what we're calling the Patho Success Plan. I'm going to turn off my camera so that I can see over here a little bit better. Okay, the Patho Success Plan is 3 steps. First step, for students to know all bold terms in their assigned chapters. Make a list or flashcards to help them study and learn. It tells them they must know the anatomy of how each system works. But anatomy is not pathophysiology, and thus is previous knowledge that you as faculty should not need to spend significant, if any, time reviewing. There is assistance in the link, Human Anatomy and Physiology Guide. There are wonderful things within that guide for each and every system. So students who need assistance with, say, GI, anatomy, and physiology, they can go there and get that information prior to coming to your class. Then there are 2 parts of the process for each disorder. The first start of the process is knowing the definition of each disorder and the cues that the nurse should anticipate seeing for those disorders. That is the first step in the clinical reasoning process, recognizing cues. They should also be able to understand what makes them similar, what makes them different, and are there risk factors or lifestyle concerns. That is part of that analyzing cues. So the first part of the pathophysiology for this course is knowing the definition of a given disorder and all of the cues that should be expected to be seen if a nurse knew a patient had a given disorder. Now, the second part is a little bit more difficult, and that is where the students now have to know the rationale or the why behind why the cues are being seen. What is happening in the body to create those symptoms? This is the most important part of the process, as if the student can understand why they see a particular symptoms, when they go into the future courses, they now have a strong foundation for gauging or processing what types of things would be needed to assist in promoting back to wellness or management of certain cues based on acute or chronic disease processes. Now, students can take notes in any fashion. The folder I will provide for you and the students has examples of how to organize materials to promote success during their Essentials to Pathophysiology course, as well as all nursing courses within the program. It is key that you as faculty are the cheerleaders for this initiative. The end goal is that students create their own personalized, individualized NCLEX prep book based on systems where they have every cue, the reason they see those cues, and then in the med-surg courses, they learn how to generate solutions, hypotheses, and eventually evaluate and analyze outcomes. The entire clinical reasoning process for each disorder will be on one page, one piece of paper that they can go back to and review as they find the need. So if we tell the students, if you put in this really what would be considered in their eyes a lot of extra work, this is what they have to do to be successful in the course. But if they do it very well, they are taking half of the time needed in future courses and literally minimizing it out. They don't have to go back and say, what are the symptoms of asthma? Because they have it on their paper, it's in their little NCLEX prep book, and now you as faculty can spend more time on things such as diagnostics, medications, nursing interventions, all of those generation of solutions, delegation, prioritization, the parts of the process that we know they struggle with and they need to be proficient in order to be successful transitioning into a registered nurse or licensed practical nurse role. However, without knowing the cues and their strong assessment skills and why they see those cues, they cannot begin to generate hypotheses or solutions. So now I'm going to take you to the next form. That is Form 1. I will be giving a similar explanation to the students. The second form is a clinical reasoning form just for patho. So again, this is going to be built upon, but for your course, students can choose to use only this form. It is called the Clinical Reasoning Flowchart. As you see at the top, it's the CR flowchart worksheet. Disease disorder. So I am going to show you an example, which would be asthma. We're going to define asthma. We're going to give risk factors for asthma. Then we're going to say, okay, what cues, what things would you see or expect to see with a person, a client with asthma? And they just write those cues in the box. Then we have the major task of why do we see that cue and what is happening in the body. There's a very clear red line that says stop, patho has ended. Nowhere in the pathophysiology course is there an expectation for understanding how to fix, how to diagnose, how to treat any of the diseases within the course. There are no questions in the test bank that determine that portion of their knowledge. So please, when you're having your students read the textbook, although we never say don't read, when they get to the portion where it says, here's how you treat asthma, they need to stop reading because they're using time very inefficiently. You can tell them that's a great book to go back to and help themselves when they eventually get to respiratory in a med-surg course. But for now, all they need to know is the disorder, its definition, its risk factors, all the cues that would be seen. That's your signs and symptoms in the clinical reasoning process, why they see them, and what is happening in the body. So now I'm going to show you the asthma example so that you can understand what I mean. Here is your asthma example, where asthma, the definition is a chronic condition in which a person's airways become inflamed and narrow. Risk factors are genetic, allergies, and they can continue on. Cue number 1 is wheezing. Cue number 2 is cough. Why do I see wheezing? Because of bronchial constriction. But now, why do I see bronchial constriction? Why does that happen? Because there's a trigger initiating the inflammatory response. Coughing, swelling, and additional mucus create exudate and constriction of airways. Cough. Why does a cough occur? Because the trigger inside the airway. Well, what is that? A trigger is an irritant or a foreign body in the airway causing the body to try and expel the irritant. That is the level that is required in order to be successful in Essentials to Pathophysiology. The student can stop there. Now, obviously, I picked a very simple, very basic disease process or disorder, but you can use this in any course. So encourage your students. Tell them when you get to mental health, schizophrenia, what is it? What are your cues? Why do you see them? That is the beginning portion. But really be the cheerleader for, look, when you do this well now, when you get to med-surg, you're going to use the same form and you're going to fill out the bottom portion. But the top portion is done. You can quickly review and really focus on what needs to be focused on in order to maximize their study time, maximize their reading time, and encourage those strong exam results, eventual comp predictor results, and ultimately NCLEX pass rates with strong clinical reasoning students coming into our workforce and communities. The third document, because I don't want to overwhelm, is the complete and entire what it would look like if it was in a med-surg course. So those of you who teach other courses such as MDC 1, 2, 3, or 4, this is what you would see. Because again, the first part is done for them. So this is the part that would be done in patho, the disease disorder, the definition, and the risk factors. Then you have all your cues, all your whys, but then solutions. What nursing or medical interventions, and be sure to prioritize. That is called taking action now. What would you do for this person? And then we evaluate through patient education, primary, secondary, tertiary prevention, or long-term care? What would a patient need to learn in order to manage that disease or disorder? The entire clinical reasoning process is now on one sheet. Now, when I show you the final document that has all of the modules and every disorder that is encompassed within that module, if students fill out the form that was originally shown with just the Q's and the Y, they will be successful on their assessments as well as in future courses because they have built a strong concrete foundation to move forward into the rest of the program. So I'm going to show you that document now. And again, I'm not here to overwhelm, but this document is now called the Master Modules Terms. DD is Disease Disorder List. So what this form has is, again, the directions on how to be successful. Oh, it didn't go. Hold on. My apologies. Try one more time. There it goes. So what we're going to do is we're going to ask the students to, first and foremost, make a list of disorders in a notebook. They need to take notes, make flashcards, but our suggestion is to make a notebook for each system. You could have a 5-subject notebook. You could use 2 big notebooks. You could use a large 3-ring binder with 9 separations, as there are 9 systems that we work with. Really cheerleading the personally made NCLEX review book. These are the notebooks they will take through into their next quarters. So when you think about doing the integumentary system and all of the different cues and how you explain why you see those cues, now they enter into MDC1, and lo and behold, they have dermatology and skin disorders again. But now what do they do with those skin disorders? How do they treat them? How do they prevent them? How do they manage chronic disorders like eczema? Half of the work is done for them. So what they should do is they need to answer these questions if they're taking notes. If they choose not to use the form that has been created that they can fill out, when they're taking notes, they need to answer these 6 questions. So they would write asthma at the top of their notebook and say, okay, what is its definition? What are its cues? What makes them similar and different? And are there any risk factors or lifestyle concerns? And then they need to say, okay, I saw wheezing. Why would I hear wheezing? Why would I hear that? And what is happening in the body? If they prefer to do it in narrative form or in a concept map or in, multi-different colors, whatever the student feels will help them be successful is great. I personally am not opposed to any and all different type of note taking. I really encourage you as faculty to, at the beginning of your day, say, hey, let's see your notes, and quickly just walk around the room, take 2 minutes and say, hey, what did you write about? What did you read? What did you learn? And what questions do you have? Because as I went through and I created all of these modules and all of the different topics, there's a topic where there's genitourinary, and there's a whole section on incontinence. But, if they fill out the form appropriately and it's stress incontinence and here's what you see and here's why you see it, and functional incontinence and here's what you see and here's why you see it. There's not really a lot of variation, and it's not really that difficult to understand versus some of the other disorders where now you have hypertension or CHF. And you really need to have a better handle and time frame to teach the students when they have questions about why they see the blue bloaters or the pink floaters or vice versa. We really want to make sure that what they need support and understanding, they are getting. So again, if they come prepared with some, if not all of these disorders already written about, they don't have to read the whole chapter. They need to focus on cues and why. Then the more robust, great, fun conversation comes from you in helping them clarify out any questions they have and promoting the assistance of understanding the cues themselves. Now, the other option is that they do use the clinical reasoning flowchart. So it is attached right here with the simple example with the asthma, where it says patho has ended. But then this is what they would do as they progress. Module 1 content. Here are all the terms and disorders that they need to know. And here are all the terms and disorders they need to know. Module 2, all the way down through. I have every module already finished. Every item, whether it is in the test bank or whether it is in their textbook. Any disease, disorder, or terminology that is important has been listed. You can see there's numerous different fractures here. All of them are of great importance. They need to know the difference between a green stick and a pathological fracture, what the cues are and why they see them. So they can use either note-taking and answer the questions, but they can also use the clinical reasoning worksheet, knowing that just like the asthma example, they can then take that same piece of paper out of their notebook, bring it to their MDC2 class where they learn about GI and GU, and finish filling it out. It gives them a real sense of accomplishment, knowing they do know more than they think, because they have already prepared the first half of your lecture prior to entering into that course. That is the goal for this initiative, to give students a feeling of control over the way they manage their time and how they learn the things they need to learn in order to be strong clinical reasoning nurses when they graduate. This initiative, although they may feel it is a significant amount of time, in the long run, they are putting time forward when they don't have 2 or 3 clinicals or an extra lab or extra simulation. And they're getting a foundation that is unprecedented to help them as they move forward. I'm going to stop sharing. And last but not least, I would like to make sure that as we review yet again the documents and how they would be used, I'm going to share one final time and show you again, this is the beginning. They would complete in pathophysiology in your course. They take this same piece of paper that has the second sheet to it. Okay, so they would have this paper and they would say, okay, we did the first 2 sections. Now you're entering into my course of MDC3. You said you saw confusion. And why are you seeing it? Because of lack of blood flow, because of whether it is a cerebral hemorrhage or a clot, whatever the disease is. Now, what would you do about it? What solutions would you have? Nursing, medical interventions. What would you do for that particular problem? How would you prioritize out all of these actions? Who would do those actions? Can a CNA do them? Can a UAP do them? Can an LPN do them? And then finally, how will you ensure that your patient knows how to either manage or prevent that particular cue from occurring again within this disease disorder? I am hopeful that all of you find this to be a significant support to your class. Again, I am asking everyone every week to post the announcement I send out with my little tiny, it's going to be like 5 minutes, 4 minutes, very quick cheerleading, how to get ready for this week's module, what it really entails, and why the book, that personalized, individualized NCLEX prep book that they're creating, will help them through the entire process, because I'm going to have other students come and explain how they used this to help them. And now they're in MDC1 and they're finding it to be very useful. I really want to encourage all of you to really embrace this and give me as much feedback as we can. I am going to be creating a little mini group for clinical reasoning, clinical judgment, to see if this is something we're going to want to use throughout all of the courses. And if we are, then we will start that process as well. But if you have other courses you teach, or you have peers that you want to share this with, the more we get this process into the hands of the students to make their lives easier, where they can control how they review the material within the book and bring it into the classroom, so that you can have those great, robust clinical reasoning sessions with case studies and NCLEX questions, instead of what is wheezing when they're in MDC3. I really hope everybody is excited as I am, and I look forward to all of your comments, good, bad, indifferent, but I really want any and all comments. If we need to tweak the document, or how we interpret the document, or how we deliver the document, I am open for any and all suggestions. I am going to start with these very quick, very cheerleading type, exciting mini videos for the students. I am relying on you to please send those announcements out every week. Post all of these documents in a folder within your course, but then I will send each week that same piece of paper for each module, so that when you place that announcement, you can also send the attachment so that they have the modular objectives and the list of topics that they need to be completing prior to coming to class. I hope everybody had a wonderful break, and I am looking forward to an exceptional new year, where the success of the students and the success of you, the most important part of the puzzle, the faculty delivering the very, very difficult concepts within our nursing profession to our new and engaged students, and our community who relies on those students to be as strong and knowledgeable as possible. Thank you very much for your participation, and I look forward to seeing everybody soon. Happy New Year.